Good afternoon. Welcome to Black Mental Health Matters. My name is Sista Oloruntoyin, and we are streaming live to 2 Nakechi TV channel, United States of Africa, GPAN platforms, on Twitter via Africa Republic at Alebukan, and on LinkedIn discussing, and we are pleased to have following panelists: Sister Ajibola Lewis and Oluwakemi Lewis, the mother and sister of the late Seni Lewis. We have as well Patrick Ogumiyawa. We have Omilade present. We have Ronke Bisiriyu, and we are very, very emotional about this topic, as we see the case of George Floyd has again brought up something which is not new, which is happening not only in the United States of America, but in several countries. It's a global problem. And we here in Black Mental Health Matters, we want to also talk about this special case that happens with the intersections of not only being Black, but being affected by mental illness or having to undergo a mental health crisis, and this leading to death. Because the responses that are being used, the approaches, are really a great disturbance. We have had the case also in Hamburg of Brother Tonum Bobda, and in several other situations. I would like to start by simply asking the panelists to introduce themselves and to discuss the case of what has been going on. So like I said, we have here Ajibola Lewis and her daughter, Oluwakemi Lewis, and I would like them to start off by please telling us about yourself, what you are doing, and about Brother Seni Lewis, how he died, what exactly happened, what is the case?
Good afternoon, fellow comrades. I'd just like to thank the panel. Kevin, I think Sister forgot to announce him, but Kevin is somebody I work closely with. And Runke, I've never met, but I've heard a lot about her. She's a general practitioner. And Patrick, well, Patrick is an accountant, a neuroscientist, living in France. And Omilade, who's a very close friend, who has been my support and and confidant for many, many years, and was very helpful when we lost Seni. And of course, my dearest daughter, Kemi, my eldest child, who has been a support, all her life, but especially since her brother was killed by police in 2010. Just a brief resume about what happened. Seni was our youngest child. We had 2 daughters, and he was the last born, a boy. He was everybody loved Seni. He had a lot of friends, very popular. Nobody had to tell him to study and do well. Nobody had to tell him what was right and what was wrong. He knew. Not that he always did the right thing, he was a young man, but he had a real heart for the marginalized. He had a real heart for the underprivileged. He was very supportive because I had a brother in a wheelchair who had polio, and he supported me. He was a bit of an adventurer, it made me get him a tarantula to keep in the house. And he, went jet skiing and went way out in Florida, wanting to reach Cuba. And I had to tell him that Cuba, people are trying to get out. At that time, this is in early 90s, and not trying to get in, but he was like that. Anyway, this weekend, August bank holiday weekend, he went out to celebrate the end of his master's, and he was getting ready to maybe go to America to do his PhD. And he came back, and he was came up to me and said, "Mum, they've given me something bad, or I've had something bad, and but I'll be all right." And then we noticed over the weekend he became progressively agitated, unsettled, and eventually he decided he wanted to go to the hospital to see what was wrong with him. And you get an idea, maybe they pump your stomach out and you'll be okay. We didn't know, Anyway, we were able to eventually take him as a voluntary patient to a hospital. I'm compacting what happened in a few seconds. And we took him to one hospital, and then they said they didn't have beds for him. But at that hospital, we saw good practice. We saw de-escalation techniques. We saw police who were called, who stood back and watched, did not intervene. They took off their jackets. They talked to him at eye level. They were friendly, they cracked jokes, so we were able to experience good practice at the beginning of the day. But eventually we had to take him to another hospital, which was absolutely chaotic. I wasn't happy. And as we were leaving him, his father, myself, and his best friend were leaving him at 8:30. They had all our numbers. Yes, he's a voluntary patient. We will call you if anything happens. But I talked to my daughter. I said, "Kemi, I'm not happy. I think I'll sleep in the car park." And she said, "Mum, you're tired. Come home." So I did go home. And about 10:30, his best friend called me to say, "Mum, there's been an incident. Have they called you?" No, of course, they haven't called me. When I called them, they said, "Yes, please go to the hospital." And when we got there, we found him on life support. And eventually, after a few days, they did a brainstem test and found that there was no activity in the brain. And on the Saturday, September the 4th, actually, we turned off the life support. But, they say his date of death is September the 3rd, when they did the first brainstem cell test. So it was then a long 7-year journey to get our inquest. We were very blessed because we'd moved to a church. My daughter and I had moved to a church just before he died. And we were introduced to somebody, the sister of somebody who had also been killed at Brixton Police Station 2 years before us. And they are big campaigners. So they were able to really give us a heads up, because we had no idea what to do. We had no idea. And so they got us a lawyer through a charity called Inquest, which supports families of loved ones who have died in state custody prison, immigration centers, police cells, and hospitals. And so we got a brilliant lawyer, Rajibat Bat Murphy, and we were also able, which is very important, to stop the autopsy, because what they like to do is do an autopsy as soon as a person is dead. And then they don't invite the families, and they film it, and you don't know what really goes on. So we were able to stop them doing an autopsy on that Sunday afternoon, the day after the machine was switched off. And we were able to get our own pathologist, which we paid for, and he reported to us. So that's really important. A lot of families don't get that. Can I just say there are thousands of families in England. I think since 1996, there have been over 1,000, nearly 2,000 families who have lost loved ones in state custody. So this is not just a little thing. This has been going on for years and years. Since the 1960s, when records have been kept, So, and it really spans across all nationalities, but predominantly in mental health units, it's Black men, predominantly Black men. And I just want to get that. Sorry.
Mm-hmm.
Sorry.
Thank you.
Yeah. And anyway, so eventually we got our inquest. We got a successful inquest, jury verdict, saying that the police had used excessive, unnecessary, disproportionate force and restraint and had killed him. Meanwhile, the hospital staff, a doctor and several nurses, were watching the police and were unwilling or unable to come to my son's help. And he was restrained for over 45 minutes by two sets of police officers in two sets, and they restrained him with two sets of leg braces in a prone position on the floor, on your stomach, with like this. One hand was in front of him and one hand was behind, two sets of handcuffs, two sets of leg braces. And when he went limp, when life had finished, really, but they could have resuscitated. No, they said he was faking it. He was pretending. And they left the room, left him dead, didn't do CPR. By then the door locked. They had to find the key to the lock. They had to open it and do CPR. And of course, they do resuscitate you, and you pray that the person is going to come out of the coma, but unfortunately, 45 minutes is quite a long time without oxygen.
Long time for the brain to be without oxygen.
Yes. And so that's what happened. Well, we're fighters, and we continued the fight. We got the inquest after 7 years, and in 2018 we were able to get a law passed. If you Google Seni Lewis, Seni's law, it will come up. That's not the actual name, but everybody knows it as Seni's law. And this was passed in 2018, and it's actually called the Mental Health Use of Force Units Act. And Kevin has been instrumental in helping us sort out the guidance, because the law is on the statute books, but if the guidance is not, that means you can't work the law. The guidance is the money bit. Is the actual nitty-gritty of what happens. And Kevin has been so instrumental. And I think he will share a little bit about Seni's law in a little while. So really, we continue the battle. That's all you can do. You continue the battle with many friends. We have a loose cooperative of families called United Family and Friends, UFFC. You can go on Google and you can support us. You can donate. We have Inquest, a charity that supports families. They're brilliant, gave us all the advice. Our lawyer is an inquest lawyer. So this is what we do. We campaign for our family, for other families. And I think my daughter wants to talk a little bit about police in mental health units and how she feels as a mother of a young Black man living in London.
Exactly. Thank you so much. Thank you so much. So, Sister Oloruntoyin Lewis, I'm really very sorry to hear what has happened to your brother. And like your mother said, you would talk a little bit more on that. And also, I know you have an organization, Free Your Mind Therapy. Can you please tell us again what impacts does this have on the family? And yes, go ahead.
Good afternoon, everyone. I hope you can hear me.
Yes, we can hear you.
Yeah, it's Kemi for short. I know Oluwakemi is a bit of a mouthful, so it's Kemi for short. Mum has kind of explained, the long journey, 11 years down the line where we're at and what's gone on. I find that I recognize the fact that I'm living in London. It's where I was born. It's where I've spent majority of my life. I have a son who's about to turn 18, and he's born and lived here. My sister's born and lived here most of her life. My nephew, who's 11, has lived here all his life, and our community, friends and family who have all lived here. This undertone Black and living in London, as a parent, you notice it, when you are having to pray on a daily basis that when your son or your children go out, that, they will be okay. You have to have conversations with them, explaining to them, if you get stopped by the police, you are not, you are courteous, you are, you don't argue and you don't speak back to them. It's yes sir, yes ma'am. You have to be on your guard, because it is very, it takes a second for something to happen. And, it's very unfortunate that this is the world we live in, and this is what we're having to teach our children. I remember watching on the news a few years ago about the mayor of New York City. I mean, he's a white guy and he's married to a Black woman, and having to talk to his son about going out and being careful about being stopped by the police. So it's everywhere. But the fact that, this is where we are in life, and it's quite a tragedy, and I feel it's quite a shame that, we are having to have these conversations with our children. But it's a necessary talk that has to be had, and it's a conversation that needs to be brought out into the open and in the community, because that's where the work has to be done. Seni was a young Black guy. It wasn't like he was, a homeless person or anything. He was an educated person. So it was a shock to find that this is where this has happened. This is how it's happened. But it doesn't matter what your background is. It happens to all sorts of people. My son, it's 1,784 people who have died in police custody. That's not only on the streets or in your homes, but it's through prisons. It's through people in hospitals. That's a staggering amount of people and amount of families who have lost their loved ones, and in this way. And you find you're the one on the defense, you're the one who's fighting. There is no support out there, and we have to do better. Number one, the responsibility lies on the community, that we as Black people have to rise up together and work together as one. We can't be divided. We have to work together as one. we have to also have people who are accountable. People like the police. Up to today, there's not been one police officer who has ever been charged with, you know, with anything to do with a police death in custody. Now, if you and I, God forbid, did something, you would see how they would come after us with everything. So it should go the other way around. But there is not one police officer has ever been held accountable. Also, our young people have to be educated to the fact that, listen, all right, and I say this very openly, not trying to ruffle any feathers, but the color of my skin is black. I am fully aware I may have been born in England, I may have a red passport, but I am not English. This is not my country. So if they tell me to go back, hell, I go back. It's, we have to, I know any other country but England, but this is, we have to get our mindset prepared for, this is where we are heading. Because at the moment, racism is taking over everywhere. It's not just in England, it's not just in Germany, it's in the States, it's even when you go back in, you know, we're from Nigeria, there is a certain level, you know, in Nigeria, we have a lot of Chinese. And so there's been, they open a Chinese restaurant, excuse me, sorry, I do have a bit of a cold as well. They opened a Chinese restaurant, and in the Chinese restaurant, you can go in and, but as a Nigerian, all right, you can go in and buy the food, but you can't sit in the restaurant to eat. Now, these are Chinese people in Nigeria. And I'm like, pardon? You're in my country and you're telling me I can't come into your restaurant to eat, but I can do a takeaway? No. All right, so it's there on different levels. So we need to now come together as one and figure out how we're going to educate our young, and we have to rise together as well. It's not that this person is working on their own, this person is working on their own, that person work together as one.
We have to be united.
We have to be, because they will break us. They will break us if we are not together as one. And the responsibility lies on each and every one of our shoulders. When I go to bed at night, I pray for my son, I pray for other people's children. But it's then when I'm praying, I have to go out and work. As a Christian, I love my brothers and sisters. My brothers and sisters are not only the people that look like me, they are the people who are my next door neighbors, people in the next country, next city, who may not look like me. Whether you're black or white, this cannot be. And we have a duty to be able to, you know, be able to work as one. And at the moment, for me, speaking and having community activities, and then also going into local law enforcement agencies and working with them to be able to do community projects, to be able to do things, to be able to build bridges so that we all can work together as one, whether it's through basketball, music, mentoring. There are thousands of ideas. And to tell the truth, we can't be afraid. They'll say no 1,000 times, but somebody will say yes. So we just need to keep on at it. And I just pray that, you know, us working together is a way in which we can all inspire each other and help each other and pull each other up, you know, to be able to say, okay, you know what, we'll do this together, we'll work together, and we will help open people's understanding, and also educate our young people on the way forward and the way to be able to bring down these numbers and just know how to love one another and love yourself. Because at the end of the day, if you're loving yourself, all right, and you know who you are, it's half the battle won. The other bit is us working together. And if we put them both together, you know, we will be successful. So I hope that kind of explains where I'm at with all of this.
Yes,
I just
definitely.
wanted, you know, you always talk about the fact that police, you don't want to see police in mental health units restraining. And you know what, we talk about the big gang versus the little gang. I think you should, you know, you've got, maybe.
Yeah.
Yes, we can come back to that. That's a very important question, which we can talk to later. But first, I'd like to ask Sister Omelade Shirley Martins, who is an African-centered mental health advocate. What is your approach to this problem? First of all, is law enforcement or police, are they the right instance to respond in the case of a mental crisis?
Good afternoon, brothers and sisters. Can you hear me?
Yes, we can hear you. Good afternoon.
Okay. Quite frankly, I am not particularly interested in working with the police and the system. My focus is on community and actually working to prevent us ending up in the system. That's been my focus for a number of years. And that started in 1991 when I met Clara Buckley, who was the mother of Orville Blackwood, who was murdered in Broadmoor prison. That was his 5th year he was killed. His sentence was 4 years. And he was kept for another year, even though they couldn't tell him why. And on that fateful day, he didn't want to join group therapy. He wanted to stay in his cell. And they entered his cell and he asked them to leave. And he was forcibly restrained, injected with 3 times the dosage that should be given of tranquilizers, tranquilizer, yeah. Mm-hmm. And Orville died. And I remember meeting Clara Buckley because she used to go around all the community events. I've been involved in community activism since I was 18. I'm now 68. I've been in this country for 56 years. I was initially involved in supplementary schools, moving African Caribbean children out of educationally subnormal schools and back into mainstream schools. So I've been involved in community activism since I was 18. As I said, I'm 68. Clara used to walk around with a picture of Orville and talk about how they murdered her son in Broadmoor. And as a community, we were horrified because you hear these things. After all, he was the 3rd person who had been murdered in Broadmoor. But the fact that she was walking around the community was very painful for us. So we started talking about what we needed to do to protect our mental health as African Caribbean people. And part of that was about acknowledging that, yes, we were born in the Caribbean. So that's why I say African-centered. We were born in the Caribbean, but we're African people. And when we are walking the streets, nobody can tell whether we are, quote unquote, West Indians or we're from the continent of Africa. And having a good sense of who we are, we felt was very important to maintaining good mental health. And so we were meeting as communities and talking about building a village to support each other. So we got involved in things like Boys to Men Rites of Passage. So new initiatives were running those, Origin. Then we're doing Girls to Womanhood, the AKUA program, supporting and mentoring our young men and women and supporting families. Because part of what happens to us in this society, I feel, is that sometimes we want to assimilate. We want to deny who we are because we're looking at strategies to manage the racism. And it hasn't served us well. And for the most part, we know that progress is really important. We focus a lot on education, but there is a lack of understanding very often from parents and carers about the effects of racism, even on our young people. And so one of the most important things for me and what I work to do is to work with families to try to raise their awareness about how pervasive racism is, how it affects the core of who we are. Kemi talked earlier about constantly being on your guard. And I talk about the number of masks we have to wear to manage ourselves in this society. The young people call it switching, code switching, I believe. So when you go to the GP and you want to talk about the fact that you're feeling emotionally fragile, you put on one kind of mask because you know that you can get 6 sessions of CBT from the doctor. But what they really want to do is just prescribe tablets. You take that mask off. You go into schools because your children are having a problem. It's a different mask to put on. In every area of our lives, we have to put on a mask. And I think sometimes we're not sure which mask we should be wearing. And we're wearing all of them at the same time. The stigma of mental health that we imbibe as African people is unhelpful to us and our community. So we have to be able to build resilience. We have to acknowledge the racism, and we have to, yes, Kemi, support each other as a community. And not all of us have the brains, the intelligence, the access to the system like Kevin and Patrick and Ronke, probably, and Kemi. I'm not that bright. I take my place in the community. I am happy to work with people, but I don't think my strength is being involved in the system. My experience has been about working with the community. And I have personal experience of how that load that we carry can have an impact on us. I have a niece who is 14, whose mother has been chanting as a Buddhist for so many years, trying to manage her daughter's anxiety. And at 14, she's on antipsychotic medication, for goodness sake, you know? So that's what I do. Thank you.
Thank you so much. Thank you. At this, I mean, when you talk, I really feel what you're saying, because here we are dealing already. The mental illness is often a consequence of the racism we have to deal with daily. And then having to deal with this challenge, and at the same time, the stigma in the community, and not even being able to go to the clinic or when one needs safety, to also be in fear when you go to the clinic is a major, it's a major problem. I would like to ask Brother Kevin Ario to step in. Your area is combining not only mental health advocacy, but also justice issues. Please tell us what you do. Introduce yourself. Tell us what you do.
Hi everyone. So I'll share my slides in a minute, but just to say that my name is Kevin Ario. I'm a PhD student at the Mental Health and Justice Project at King's College London. I mainly look at mental health law in England and Wales, and particularly how it affects people from ethnic minority backgrounds, and especially Black people. Will be things looking at like sectioning, but also the use of restraint. And yeah, just thank you for having me today. And I especially wanted to shout out Adji and the Lewis family just for all of their tireless activism over the years. It's just so important, and I suppose my role is just giving that more prominence and making those voices feel as loud as possible. So yeah, with all of that, I'll try to share my slides. I haven't used this before, so it might take a couple of seconds. Can you see? Okay, 1 second.
No.
Yes. I think.
Yeah, I'll do it quickly. Nearly there. Okay, it won't let me share my screen without logging out, so I'll just speak to it instead.
Yes.
Okay, so first of all, I wanted to talk about the Mental Health Unit's Use of Force Act that I've been working on with AGI. I want to start by saying that it started as a bill, so a bill to produce a set of national law, and yeah, it was put forward by a Labour MP for the local area where Seni was from. It was put forward by Steve Reed in response to the death of one of his constituents, Seni, due to excessive use of force by the police. That constituent was Seni Lewis, and to honour his legacy, the act is widely known as Seni's Law. The main focus of the act is, first of all, to reduce the use of restraint in mental health patients and to train staff in alternative ways of keeping them safe. And these are, of course, issues that disproportionately affect people from Black backgrounds in particular. And that's something that I'll go on to a little bit later in the presentation. The Act also seeks to make mental health services accountable for their use of detention and restraint. And so there's various policies in the law itself to make services more accountable for this, to improve transparency. And for example, they will install a named person in every trust to make them accountable. And I'll go into the specific details of the policies later on in the presentation, but I thought it'd just be helpful to bear in mind those broad aims. And with any national piece of legislation, it's important to make sure that it's tailored to our local communities. For example, in South London, where I'm from and where, of course, the Lewis family are as well. So I wanted to start off with a more general context into our area in South London. And yeah, the fact that it's been a place where quite a few people of Black descent have been killed by state institutions. So to understand the most persistent inequalities in South London, you need to understand racial demographics. And in South London, the proportion of people from a Black and ethnic minority background or a migrant background is over twice the national average in England. And looking more closely at the numbers, many of the migrant communities are from West Africa, South Asia, or the Caribbean. And of course, many other ethnic groups are also represented. It's a really diverse area. The local population is not only diverse, though, they also face a number of challenges. And I've given just 2 examples in socioeconomic status and schooling. The most recent figures suggest that child poverty is around 40% between the 4 South London boroughs, which is around a quarter higher than the national average. And now looking at school exclusions in the 3 inner London boroughs, so excluding Croydon, the rates range between 25% and 70% higher than the national average. This is just a snapshot of the overall picture, but I've mentioned poverty and school exclusions because they're examples of things that affect mental health over the lifespan. And I'll just summarize by saying that racial and structural inequalities and the intersections between them will be important to bear in mind when talking about any intervention, and that includes reducing the use of restraint. Yes, so to share my screen, I would have to log out of Chrome. So yeah, I'm not sure whether the hosts want me to do that. I would have to log out.
Yes, you could choose, you could share the Chrome tab.
Yes, I had to change my permissions on my computer to do that. So it's saying I have to close it and then open it.
Okay, thank you.
Should I do that quickly?
Yes, you could try to do that. So in the meantime, we have also
So my issues, I can't really see. Everything's just, obviously I can see the people, but I can't, nothing is clear.
okay, so everybody is there. We're having some network problems. Brother Patrick Ogomuyiwa, can you please
Kevin
introduce
is
yourself?
back. Sorry.
You can see my screen.
Yes.
Brilliant. Right, can you still see the screen?
Yes.
Okay, great. I'll carry on. And now that we've spoken about the more general inequalities, I now want to talk specifically about mental health in Black communities in South London. And this research has focused mainly on people with psychosis. And we know that people from Black backgrounds are overdiagnosed with psychosis. The overall picture, on the one hand, is that Black people face barriers to accessing services through GPs and primary care, as well as psychotherapy services, so getting therapy. And for the non-coercive pathways, they are underrepresented. So on the other hand of the picture, some studies find that Black people in the area have higher rates of police involvement and lower satisfaction with the psychiatric medication that they receive. So I think Omalade alluded to this, that Black people are often over-medicated, and there's some evidence to bear that out. So there are concerns over the care that Black people receive locally, but also concerns about the care that they aren't being offered. And it's important to improve support before and after Black people enter services so that we can reduce these disparities. And now that we've heard about the challenges, what are we doing specifically to reduce restraint in South London? So my work with the Lewis family, the Rigg families, and others. One of the first things that we're doing is around training. and we think there's huge scope to improve things locally. I should probably start by saying that South London and Maudsley have historically high rates of restraint, especially in the prone position, and we all have a part to play to address these and reduce these. One aspect of Shaney's law is acknowledging that people of Black African and Black Caribbean descent are being detained much more often. So I've done research on this, and the rates are around 3 to 4 people of Black African and Black Caribbean descent being between 3 and 4 times more likely to be detained involuntarily to a mental health institution. But we've noticed that there are many clinicians in South London who don't know what happened to Shaney or what happened to other people who died by restraint, such as Sean Rigg. And this in itself, I personally find quite striking. And it's a major barrier to appreciating just how impactful restraint can be, especially on the families and the wider community. So, for example, we want people to question why the staff didn't feel able to intervene when 11 police officers were called towards Shaney. We want to be proactive in our training. One of the things that we'll be doing is co-producing a course with AGI, and that will be called Shaney's Story, to explain many of the events and the real impacts that these have had on families and local communities. I would just as well like to raise an interesting piece of research that came out of George Floyd's killing, which was they found that mental health in the Black community in and around George Floyd's area was directly affected after the killing of George Floyd. So it is something that affects the Black community on a whole. There is evidence for that. And the last part of training is we want to review the clinical training. And in doing that, we started to engage with stakeholder groups, so current staff, trainers, people with lived experience, their carers and community members, and visits to other trusts. That's mainly being led by my colleague, Lewis Beams, who, is leading on this. And now, in talking about information provision is another thing that we think is really important. And there are two sides to this, really. There is monitoring the data. So that's a very important question, but it's also very technical. That's really to make sure that we know what is going on, that if there are inequalities, we know about it, and we can know when we're doing better on it, so we can set solid, tangible targets. But there's also the information provision side, which I think is equally important. And it's really about addressing some of the mistrust between services and the local community, and making sure that we are being as transparent as possible, and also maximizing the amount of choice that patients have and that carers have in their involvement in mental health, really underlining that mental health is best cared for in the community, not in institutions. The key question here is, how do we provide information around restrictive practices to people in the community? And I think that means working both with people who have never been in the mental health system, as well as those who have already been in the system, even if they've had bad experiences of care. We've been thinking about how different people prefer to process this information. And so we'll be using things like social media and community spaces, halls, churches, and things like that to really get people's thoughts on how they would most like to be and to start this communication. But we also have to think about the impact of communicating things like restraint. This means mental health services being open to be challenged and having to reflect on why it is that mental health services might see things differently to the communities. It really has to remind us of the impact of restraint on families, even when professionals consider these practices to be necessary. And overall, we think that just having this dialogue will bring us much closer to the people that we're trying to support and the organizations that already support them, really recognizing that actually a lot of support comes from outside of mental health services and instead comes from like the voluntary sector, social care, faith groups and everything else. So really bringing all those different bodies into the fore, I think would help support people a lot more. And finally, this work is running parallel to Seni, the independent review of the Mental Health Act, which is also statutory law. But in terms of Seni's law, where is this at nationally? So the bill gained royal assent in 2018, and since then there had been delays due to Brexit and the coronavirus pandemic, which I know has been frustrating for us working on Seni's law. Now we're finally at the stage where Seni's law is one of the top priorities for the Department of Health in the government. And Aji and Marcia have been deeply involved in Seni's law at the national level. And as a group, we're continuing to consult with policy members alongside other groups like Inquest, who advocate on behalf of families affected by deaths in state institutions. And finally, we're pleased to announce that the government consultation on the Seni's law guidance should be is actually open now. And if you do work in mental health services in England and Wales, we would really encourage you to take part in this. This is really about the guidance that professionals will get on Seni's law, and we really want to make sure that it's direct and to the point and doesn't give many loopholes for poor practice. We would really encourage you to think about the Mental Health Act's white paper as well, if you're in England and Wales, and how this might interface with Seni's law to improve practices around restraints. So yes, thank you. And if you have any questions either now or during the Q&A, please feel free to look through. And I hope I've kept to time.
Yes, thank you so much. Thank you. Okay. So you said something which was very striking. You said, how do we take the mental health issues, addressing mental health issues should be, the care should be in the communities and not in the institutions. Now we have Brother Patrick Ogomuyiwa, who is part of Colorful Minds. Could you please tell us what you do? Yep. Introduce yourself and tell us what is Colorful Minds.
Can you hear me?
Yes, I can hear you.
Fantastic. All right, good afternoon, everyone. Thanks very, very much. It's been very, very interesting to hear, Aji, your story, which is very, very tragic. I'm sorry you've had to go through that, experience that. And Kevin and, sorry, I forgot your name, Olamide, to hear the stories and the inputs and parts that you play in the community in trying to make things better. I've got a slide presentation to give also now, so I'm just going to try and put that up on the screen. Hopefully that should work fine. Which is just to give you a bit of a background to Colourful Minds. I'm here representing Colourful Minds along with Ronke, who will speak later on. Hopefully, can you all see the slides? Just as a question, can you see my slides now? Yeah,
yes,
slide.
We can.
Yeah, so I'll just give you a bit of a background to myself. My name is Patrick Ogomuyiwa. I am temporarily the charity lead at the moment. And I've been working with the organisation to try and get it set up. I'm actually no longer a neuroscientist. I did start off and I trained as a neuroscientist, but I'm actually a chartered accountant, but have been working with Colourful Minds to get it set up and working with Colourful Minds through to BAM also to help them get that project set up. And I'll tell you more about both of those things now. Right, okay, so Colourful Minds was founded in 2017 and was founded by Julie Ogumura. You might notice the similarity in name. She actually happens to be my sister, and she is a psychiatrist at the at SLAM, where Kevin works, and she identified an unmet need in mental health amongst the Black and ethnic minority communities. So this is basically relates to actually having the voices of Black and ethnic minority people to be involved in the debate and in the structural development of mental health services that will disproportionately, as Kevin pointed out, affect people of Black and ethnic minority communities. The charity actually started off by delivering mental health workshops to schools, in schools and churches. So basically actually work in the community to devise some workshops to help break down stigma with mental health and to provide help and understanding for people about mental health and mental well-being, to help move things along. And it started off as a voluntary-led organisation, and has steadily grown, and recently this year, in March this year, became a registered charity in the UK. So what does the charity do? So the charity is basically, it aims to be an ambassador for mental health and mental well-being, both in and on behalf of the Black community. So what the charity aims to do is effectively engage it as a conduit for dialogue between the community and mental health services to help develop and have better outcomes for people in Black and ethnic minority communities in all areas of mental health. Why is it that we're needed? So I think Kevin has pointed to some of the issues in his in the slide that he gave there, but I'll just give some other points that we've identified also, which is that Black people are less likely to, Black and ethnic minority people are less likely to present to mental health services through their GPs, which is the traditional route that most people present to mental health, and they're more likely to present at points of severe crisis, which is obviously too late and tends to lead to worse outcomes for the individuals. Again, also there is a significant underrepresentation of all Black and ethnic minority community people in the design of services. So that means that Black and ethnic minority people are more likely to be diagnosed with severe mental health problems, and then as a result, they're more likely to die at a younger age than the majority white counterparts. And also, there has been studies that have shown, I think again Kevin's talked about this, which basically shows that better cultural representation and understanding means that there's a better outcome and there's better engagement from the people who are from the communities that when it comes to engaging with mental health services. So we feel it's important to actually have effectively black and ethnic minority people involved in the design of services that are there to do them. And finally, we also see an important role in actually effectively developing the future pipeline of talent for these. So effectively encouraging Black and ethnic minority people to get involved in mental health service and mental health and general health service design, so as to help shape the services that are there to serve our communities. Yeah, because we believe that, you know, if you have people there at the table that represent you, then your needs are more likely to be taken into consideration. So just to break down what it is that we do. So we have 4 areas that we focus on as a charity. First is advocacy, advocating on behalf of Black and ethnic minority communities with mental health services is one of our aims. education. So we aim to educate Black and ethnic minority communities and professionals in mental health about mental health and mental well-being and the reduction of stigma around mental health. So we believe that having people talk about their mental health and mental well-being more in the communities will hopefully mean that people are less likely to end up in crisis, and therefore reducing the number of people that end up in severe crisis when it comes to mental health. Thirdly, we want to get involved in undertaking and working with community partners to do novel research in the area so as to support the advocacy and the educational objectives of the charity. So the aim there is basically to make sure that we are meeting people where they're at when it comes to talking to them about these subjects, and these subjects that affect the community, and how mental health and mental well-being services affect the community and how those are designed and work. And finally, volunteering. So Colourful Minds is a volunteer-led organisation, and it aims to recruit from all sectors and all walks of life suitably engaged and qualified professionals to help us to deliver what we deliver. So whether that be people with a legal degree to help us with legal advocacy, or people who are trained psychologists or psychotherapists to help us deliver some of our clinical work, or researchers, or people that have experience in community outreach, or to help us deliver, to help us do what we do better. What are the benefits we aim to bring to community? So as I mentioned before, aim to reduce stigma and improve engagement between the community and mental health services. Improve mental health and mental well-being and mental resilience within the community through our work. Identify specific needs that affect communities. Provide career development opportunities for our volunteers to help them with their career aspirations, and build capacity in mental health within the community. So as I mentioned, we believe very, very, very strongly that having people from the community at the table when things and services and laws are being made is really, really important to help drive change and to reduce some of the structural inequalities that exist at the moment. Where do we fit with other activities? So we tend to work, most of the work that we do tend to be work that we do with other partners. So working with other third sector organisations or other volunteer organisations, or people with lived experience, to help develop our outreach services to the community. We also work and collaborate with other research partners on research projects that are taking place that disproportionately affect Black and ethnic minority communities, to help design those and make them better. And what we're aiming to do is also to work with local health services and local health institutions, using our volunteers to provide some advocacy input into the design of services. So I just want to give you a bit of a case study about our reference project, and this is one of the biggest projects that we've worked on so far at the moment. The project we're working on at the moment, which exemplifies the kind of work that we're trying to do at the moment, is called BAM, which stands for Becoming a Man Project. This project was actually name-checked by Barack Obama, who worked on who had some involvement in this project early on in his career before he went on to be president of the United States. Thanks, Aji, who pointed out that she saw that on an interview the other day. So BAM was launched in Chicago in 2001 and has now recently been brought over to UK to be trialed to basically see whether or not it will be effective in working with young people. It seeks to work with young men between the ages of 13 and 16 in deprived communities. And what we're trying to do in the UK is basically deliver a culturally adapted, a program that's been culturally adapted to the UK settings, rather than actually just taking something from the US and transporting it here. What we've tried to do is basically working with the Mental Health Foundation, who's the lead partner on this, to culturally adapt that to the UK setting and move that forward. The project aims to provide young men with a safe space for them to have open expression and receive support from their peers to build their sense of belonging, with the aim of basically trying to reinforce and develop their mental resilience and their mental health, so as to avoid them having problems with mental health, mental well-being, interactions with the criminal justice system later on down the line. As you said, the aim is basically to help the young people make better choices that will prevent them having negative outcomes, which again speaks to what Kemi says. We've all been in that situation where I think growing up, we've had our parents reinforce to us how disproportionately we are affected by these things in the community. And I think what this program is aiming to do is to work with people who are, some of whom are in very, very vulnerable situations, to give them that space to be able to develop and move forward. The project aims to use a range of mental health therapies and approaches to work with the young people, and it's usually done by counsellors, all of whom are from ethnic minority communities, working with the young people, because a majority of the people on these workshop groups are actually from ethnic minority communities at the moment. What we are trying to do at the moment is basically to work with Mental Health Foundation. So our involvement is effectively to work with Mental Health Foundation to develop a package of support for parents and teachers, so as to help provide the right kind of environment to support the young people in their work that they're doing unbound. Because I think we've all identified, because we've identified with the Mental Health Foundation, that it's unfair to basically assume that young people at such a formative age will develop on their own without having the right environment to support them. And this is a piece of work at the moment that we're working on to try and develop that package of support. And if any of you are interested in getting involved or want to know more about what we do encourage you to go to our website to find out and put yourself forward. Other projects we're working on some projects with the Biomedical Research Centre, Leaders Unlocked, which is an organisation that works in the UK with young people on a racial justice commission. We've also done some work with the Southwark School Governors Association, the BACS Adolescence Project, and the social, and we've also done some social media content creation. So this is our website details, so please feel free to go along, and if you want to get in contact with us, this is also our details, info@colourfulminds.org.uk. So happy to answer any questions that you may have from there. Thank you. Okay.
Thank you. Thank you. I would like to ask Sister Ronke Bisiriyu to please expatiate on that, on how Colourful Minds is able to involve the families in building trust in receiving mental health services.
Hello, my name is Ronke. Thank you for having us here today. I'm a GP, I work in London, and I am a trustee of Call for Minds, which Patrick has kind of given a really good summary of what we do. I echo a lot of what the panelists have said in terms of about the representation and education and how important a role it is to pull together and to try to kind of get to the stage where we are preventing rather than getting the stage where we're talking about, unfortunate cases that like Seni, what's happened, and getting people before they get to that stage and educating the community. So one of the things that we do try to do is have these workshops, and part of BAM is creating these workshops for parents to kind of learn a little bit about mental health, because I think there's a lot of stigma in Black and ethnic minority communities talking about mental health, and that prevents people seeking help early and knowing what kind of help they're entitled to. And unfortunately, the playing field isn't level.